This is Abia COVID-19 update. Abia COVID-19 update.
Some decisions were taken at the center yesterday. The federal government yesterday through the Presidential Task Force on COVID-19 during the daily briefing. Now, the Presidential Task Force on COVID-19 lifted the ban on religious gatherings in the country, but the lifting of the restriction on worship places will be based on guidelines that will be issued by the PTF, that's the Presidential Task Force on COVID-19, and protocols agreed by the state government. This will be done with strict guidelines on physical distancing. Now, the Presidential Task Force on COVID-19 also reduced the nationwide curfew from 10 p.m. to 4 a.m. It was also revealed that the ban placed on domestic flights may be lifted on the 21st of June. Welcome to another edition of the program, Abia State COVID-19 Update, the second edition for the month of June. Today being the second day in the month of June 2020. My name is Michael Oni. On this program, we highlight daily reports of the Interministerial Committee on the Control of COVID-19 as well as the Abia State Governor, Okezie Ikpeazu's efforts in ensuring that the state is safe from the virus. The program is running simultaneously every weekday, from Mondays through Fridays on several radio stations in the state. Live on BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, all in Umuahia, the capital of Abia State. We're also live on Buzz 89.7 FM and Real 99.1 FM, both in Aba, the commercial capital of the state. Globally, as of 8 a.m. today, Tuesday, 2nd of June 2020, we have more than 6.2 million cases of coronavirus that have been reported worldwide. And of course, including at least 375,000 deaths, while over 2.9 million people have recovered globally. Now, the confirmed cases by the countries, I'm talking about the first 5 countries now. We have the United States topping that chart with over 1.8 million reported cases. Now, Brazil on the second spot. Brazil cases passed 500,000. That was yesterday. More than 526,000 infections have been recorded in that country. The number of confirmed coronavirus cases in Brazil multiplied by 5 in the month of May. That was last month, because as of the 1st of May, Brazil reported 91,589 confirmed cases of coronavirus. But as of today, Brazil now has over 526,000 infections. That's on the number 3 spot. We have Russia with over 414,000, United Kingdom with over 277,000 infections, while Spain followed on that particular chart, the number 4 spot with over 239,000 infections, with Italy with over 233,000 infections. Those are the first 5 countries with the highest number of confirmed cases. You will be surprised that China, where the virus originated from, is not even on the first 5 of the countries with the highest number of confirmed cases. Now let's break it down to Nigeria. The country's tally of the confirmed coronavirus cases rose yesterday to 10,578 as 416 new infections were announced by the Nigeria Center for Disease Control. 12 deaths were recorded from the virus, bringing the total number of the confirmed deaths from the virus to 299. And in the last 1 week, there has been steady rise in the number of confirmed cases of coronavirus and deaths reported from the virus in this country. Lagos recorded the highest figure of confirmed cases, reported with 192 infections yesterday, as the state remains the epicenter of the disease. And there was an increase in the number of infections reported on Monday, that was yesterday, with 416 compared to the number of reported cases on Sunday, with 307 reported on Monday. Now, till date, we have 10,558 cases of confirmed coronavirus cases in Nigeria, with 3,122 cases that have been discharged. 299 deaths have been recorded in 35 states and the Federal Capital Territory. And since the beginning of the outbreak in Nigeria, that's in February, 63,882 samples have been tested by the NCDC. So as it stands now in Nigeria, we have 7,157 active COVID-19 cases in the country. Now, from the figures released yesterday by the NCDC, 5 new cases were confirmed in Abia State, bringing the total number of active cases in this state to 7. Well, we are still expecting results of members of the State Executive Council and also members of the Interministerial Committee on COVID-19 in Abia State, including that of the governor of the state, Dr. Okezie Ikpeazu, and the deputy governor, Saudi Akochukwu. Remember the directive given by the Abia State government concerning ESCO members who might have recently come in contact with the late Commissioner for Environment to immediately undergo COVID-19 test and isolate themselves thereafter pending the outcome of the test. Now, they are still on isolation and we are awaiting their test results. It also formed part of our program yesterday, just in case you missed the program. This is just a snippet.
We do not have the scientific basis to say yes to that question or no to the question. For us to make that statement, we must have access to either autopsy report or the result of tests conducted on him as a person. As far as we are aware, he died from complications of high blood pressure. And indeed, we are aware that it is also possible that something triggered the high blood pressure, whether from fumes of chemicals that he handled or even from COVID-19. Over time, we have been made aware of COVID-19 test results from very close family members, and we now believe that out of abundance of caution, we must take measures to protect the rest of Abia State, and that includes testing all those who work closely with, including those of us in the Interministerial Committee on COVID-19, members of the State Executive Council, and of course, ordinarily, the governor leads by example, so he's following the same protocols along with his deputy.
Well, that's the Honorable Commissioner for Information on yesterday's. He spoke about the late Commissioner for Environment and, of course, what the government is doing concerning the isolation, the directive given by the Abia State government concerning the ESCO members who might have recently come in contact with the late Commissioner for Environment to immediately undergo COVID-19 test. And that is because a family member of the late Commissioner tested positive to coronavirus. But joining us this morning on the conversation concerning the COVID-19 in Abia State, God's own state, is the state epidemiologist, and also she leads the rapid response team in the state, Lady Peace Nwogugu. Glad to have you join us this morning, Lady Peace.
Thank you very much. Thank God I'm here.
Yes, you've been very busy. I had to pull you from a meeting. Glad to have you join us this morning. So as it stands now, we have 5 new cases of coronavirus reported by the NCDC. That was from the latest figures released yesterday. Can we have a history of what happened, probably to have an idea where it came from, so that we can take precautionary measures?
Yeah, actually, these are not new cases per se, though they are the last cases we recorded. But it's just that NCDC had to report these cases late. But we've been reporting these cases since Monday. So
you had an idea of what is going to happen since Monday?
Yes, in fact, these cases have been admitted since Sunday. All of them, yes.
So they've been in isolation since Sunday.
Yes.
Can we have an idea? Is it due to, do they have travel history, or probably it's a case of community transmission?
No, all of them are contacts of a confirmed case. He was also in isolation center. Yes. So the contacts were tested. Incidentally, 4 of them came back positive.
So as it stands now, it means we have 7 active cases of coronavirus in Abia State.
Yeah, 8.
8 active cases.
Yes, we've discharged 7.
Oh, interesting.
Yeah.
All
so
right.
we have 8 currently in admission now.
So the issue of community transmission is what I would like to take you this morning. I think I should begin with what is community transmission before we break it down on how we can curtail the spread of the virus through that particular channel.
Okay. Community transmission per se is when in a community, in a given community, there is human to human transmission of a virus like COVID-19 within a period. Like now, we will say that we have community transmission because you will see people who are confirmed and their contacts are also positive, and you see people who are confirmed without any travel history. They have not traveled outside that city, yet they are confirmed positive, which means within that community we have ongoing active transmission of that particular virus, like we have in for case of COVID-19. We have it now in Abia State. It's clearly evident because some of these cases confirmed have no travel history, so they have been within Abia, and probably somebody from outside must have come, infected them, or they might have maybe in one time or the other traveled, came back, infected others, and that the chain of transmission continues.
So how can we ensure that we stop the spread, we break that transmission of coronavirus in the community level?
Good. The surest way that we've been preaching, all these measures put in place by government, they are not just for putting up sake or for punitive measures. They are just there to ensure that chain of transmission of this COVID-19 is broken. One, always wear your face mask wherever you are going. Once you are in a midst of maybe 2-3 persons, wear your face mask. And in addition to wearing a face mask, maintain at least 1 meter or 1.5 meter distancing from another person, so that assuming that person is infected, the person will not infect you. If you are infected, you will not infect others. Then always maintain this high hand hygiene. Avoid mingling in crowd as much as possible. Avoid traveling much now, and eat good food. Thereby, this transmission chain will be broken. Once I'm infected, I'm unable to infect others, and this COVID-19 is self-limiting. Within a short time, the person will be free from the virus after shedding off the virus. The virus will not see another person to infect, and the chain will be broken. Everybody will be okay.
All right, we need to take a breather now. When we return, I will open the phone lines. I know you have questions concerning coronavirus, how you can stay safe. There are so many myths. Of course, we have someone that is very much in the studio that have the right answers to your questions. So keep your questions waiting. The lines will be open after this time out.
This is Abia COVID-19 update. Abia COVID-19 update.
It is still Abia State COVID-19 update live on several radio stations in the state: BCA FM, Flow FM, Vision Africa Radio, Buzz FM, and Real FM. And we have the state epidemiologist very much in the studio as our guest today, being the second edition of the program for the month of June. So if you have, it is time for you to ask your questions now. 0808 182 6949 or 0811 605 2949. Also drop messages on 0906 510 8289. Hello, good morning to you.
Good morning, Michael.
You're welcome. Good morning.
Good morning to our guest in the studio.
Thank you very much.
What's your name?
My name is Owakwechi. I have a question, ma.
Okay.
Please, with the rate of increase on this COVID-19, despite the fact that we have lockdown and interstate lockdown and all the rest of them, the one given by state government and the one given by federal government, madam, please, don't you think that if schools should be open and state government taking up 1 or 2 measures to make sure that every school have this infrared monitor and also using face masks, don't you think it will go a long way? Because I remember very well that we were about 500 and something before the lockdown. Now, during this lockdown, the number has increased to 10,000, and they don't you think that the opening the business will go a very long way?
All right. So
Yeah, concerning the reopening of schools, it's one thing to maybe tell somebody to wear face mask, like you just rightly said. We can ask the children to be wearing face mask. What will happen when they get to school? Will it be there to monitor them? And mind you, the infrared thermometer is just to monitor temperatures. And meanwhile, many people might harbor the virus without even having a high rise in their temperature. And children being who they are, we can't be sure that when you give them face mask or wear the face mask on them as they're leaving your house, that they will continue wearing the face mask even in the school. And children, you can't even restrict them from playing with each other, from mingling with others. So
it brings the question of physical distancing might be difficult to achieve. On the SMS line, this one says, what if a contaminated hand cook food? Will the virus still be active?
No. But then, why cook food without washing your hands? It's always advisable, before you handle food, wash your hands. After handling food, wash your hands. After handling uncooked food, and you want to handle cooked food, wash your hands. So regular washing of hands is always advisable and good for us.
Good morning to you. We lost that. Good morning.
Yeah, good morning, Michael.
You're welcome. Good morning. What's your name?
Yeah, good morning to your guest.
Good morning, sir.
Yeah, it's Alvan. I'm calling you from London.
Okay, sir.
Yeah, the problem still remains the people. Government will do their own, while the people should obey what the government has said.
Sure.
If we obey, it's not about opening churches, opening this. Are we ready to do the right thing? If you move around, you see how people behave as if nothing is happening. So, madam, there, are you going to kill yourself?
No.
You big people say, sometimes I pity you people in the forefront of this, and when you tell people, look at what is happening, they will laugh, do this. Those even using the face mask, is either they are having it on their hand or they're even putting it on their jaw. I mean, how would we stop this? So
right,
we must
Alvan,
call ourselves to order and do the right things so that this thing will stop. That's my own contribution.
Thank you
for
so
your
much. Contribution. Hello, good morning to you. 0808-182-6949. 0811-605-2949. Good day, Ma. Please, I want to know the type of food to eat in order to boost our immune system against the virus.
Yeah, always eat balanced meals. More of vegetables, more of fruits, less of sugar, more of water.
Okay. And this one is asking, what are the symptoms of COVID-19?
Yeah, symptoms has always been fever, cough, shortness of breath,
Dry cough. Okay.
or even diarrhea, and so many other things now. Diarrhea is there, fever is there, cough, sneezing, shortness of breath, sore throat.
Okay. Hello, good morning to you. 0808-182-6949. 0811-605-2949. Good morning.
Good morning, Michael.
You're welcome.
This is James calling from Omaya.
Welcome, James.
I want to know when they will commence community testing.
Okay, community. As for community testing, if you we are now on active case search. Our officers at LGA level, they are moving from facility to house, inquiring for people who have these symptoms that looks like COVID-19. If they see such, they will definitely report, and those people, their samples will be collected. And if you have need and you have people you know of anybody with these symptoms, or you suspect of anybody, you call our toll-free lines and we'll answer you.
All right. Hello, good morning to you. Hello, good morning. You're live on radio. Good morning. Okay. Hello, good morning to you.
Hello.
Yes, good morning.
Morning.
Good morning. What's your name?
Okay. I'm Mercy from Omwaya.
Welcome, Mercy.
Please, our guest, good morning.
Good morning, ma.
I appreciate the effort people are making in that discussion.
Thank you,
but
ma.
my own contribution is in the area of those who are demanding for the reopening of schools.
Okay, sir.
Please, I don't think this is the right time for schools to be opened. One, our children cannot maintain self-distancing, as you have already emphasized. They must be playing with one another, especially those who live in the hostels. they cannot maintain that those protocols that are laid down. So for now, I think the school, that even if they stay 1 year and their lives are preserved, the parents will appreciate it. Rather than rushing to satisfy some people's selfish desires, and our children will lose their lives and will all come back to be in trauma or agony.
Thank you very much.
My question to our virologist is,
okay, quickly, 30 seconds,
what
please.
of those who are really interested in taking the test, but where and how can they get the testing?
All right.
Okay, since you are in Omaya, you want to take this test and you don't have the phone numbers, you can walk into FMC, you can walk into our center at Amachara. You make inquiries, we will all definitely come.
Okay. The telehealth support center, the toll-free lines. We have one in Abia State, because on the SMS line, someone is asking, what are the toll-free lines? Telehealth support center, 0700 2242 362 0700 2242 362. I will take that again. 0700 2242 362. Good morning to you.
Good morning, Michael.
Yes, you're welcome.
Good morning. Good morning to your guest there.
Good morning, ma.
I am Coach Joy.
Okay.
I must commend the government. I must commend the radio stations. I must commend your guests for preaching, because this is preaching.
Yeah.
Preaching the Bible to people. While you're preaching, some people will hear. It will enter one ear and go out from the other ear. And some people will take it. So may God help us, because I want to support the woman that just spoke last, that schools should not be open, because children cannot manage this COVID-19 virus. Because when it comes to them, they will carry it back to their homes. So let us see what will happen. Let us adults, let us follow the guidelines, the regulations, so that we'll be safe. Because onye dị ndụ ya akpawa akụ. Michael only might not understand what I said. So thank you. Onye dị ndụ ya akpawa akụ. That is just that.
All right, thank you for your contributions there. This one is asking, please, if we know the test status, please, may we know the test status of the family of the late Solomon Ogunji? That has been made public already. That one of the late commissioner's family member, tested positive to coronavirus, and actually that prompted the government's directive in ensuring that the members of the State Executive Council go into self-isolation, where they submit themselves for testing, and also members of the Interministerial Committee on COVID-19. I want to really appreciate the State Epidemiologist for being part of the program this morning. Our time is fast spent. Lady Peace Nwogugu.
Thank you very much, Mike. Thank you, our listeners. Please stay safe. Maintain physical distancing.
Very important. All right, the program returns tomorrow, which will be the third edition for the week. Many thanks to the partnering stations, BCA FM, Flow FM, Vision Africa Radio, Buzz FM, and Real FM. My name is Michael Oni. Stay safe and take responsibility.
This is Abia COVID-19 Update. Abia COVID-19 Update.